Hi, I'm Christy Agari,
And I'm Kimiko Agari.
and you're listening to the Oral Surgery Sisters podcast. This episode, we wanted to do a special reflection of the year. We are at the end of the year in December. The holidays are right around the corner, and this is a great time to reflect on all of our triumphs, our favorite times of the year, our favorite surgeries, what we liked, what we didn't like, and who better to do that with than my sister Kimiko.
Yeah, so for this episode, it's a little bit different. We wanted to, like Christy said, reflect on the year. This is obviously our first year working with the podcast and communicating on this platform. And it hasn't even been a year, Christy. It's only been since,
That's
was it
true.
May or when was
Yeah,
our
like May,
first?
June.
I think for me, when I came in May, so it hasn't even really been a year. But given that next week is Christmas and it's going to be the new year, we felt like this was a good time to just reflect on all of our experiences and all the conversations we've had this year through our podcast. And so this is kind of our Oral Surgery Sisters end of the year wrapped episode,
Yeah.
just to kind of
Yeah.
go
I think
through
it's a
everything.
good idea. I mean, just because just as surgeons, we often do this naturally in our careers and our jobs where we think about what we liked about the day, what we liked about the week, what we were proud of in our surgeries, what we could have maybe done better. And I think it's a good approach to take in other aspects of your life. So that's why I think
True.
it's a good idea to do that for our podcast.
Yeah, and so I think we've had a lot of conversations, just the two of us, but then we were very fortunate this year to be able to have some of these conversations together with other friends and colleagues in the oral surgery community. So we wanted to just reflect on those episodes, those other episodes that we've had where we've had other guests on. So our first guest was Alan Huang, our really good friend and colleague, and someone that we've just known for a really long time and who's shaped both of our kind of the past many years of training and even now our practice. And so Alan Huang, as we've talked about before, he's a sleep surgeon, and he did his fellowship at Stanford in sleep surgery. And we've talked about this before, but I think all of our conversations with Alan have been really good and in depth because of his focus and of his unique training. And I think we've talked about sleep and airway and obstructive sleep apnea and how that's, I don't want to say like a new topic, but kind of a hot topic right now.
Definitely
And
a
it
hot
kind of
topic.
has been for it's not new, but it's kind of growing, I think, in interest. And of course, there's a sleep surgery focus for surgeons who are OMFS and ENT and whatnot, but I think sleep as a whole and airway as a whole is becoming even more popular amongst other fields in terms of focus. So, like, even orthodontists, pediatric dentists, pediatricians. And so I
Absolutely.
think,
Yeah, I was just
yeah,
telling you the other day that I met a dentist who is interested in doing his own MARPEs, which is
oh, a
not
dentist?
something that I heard of in the past. Yeah, yeah, general dentist who's
Wow.
really into being an airway general dentist and has taken a lot of courses in like airway expansion, non-surgical airway expansion, which is great that people are now paying attention to the airway and not
Yeah,
just like the teeth. And yeah, like you were saying, it is definitely becoming a hot topic. uh Alan Huang, like you said, he was our guest this year, and I'm hoping we can bring him on next year too, again, to talk about some really hot topics that I've been seeing in my feed lately. Because I was talking to you the other day how I got a bunch of reels of these people posting about their, like, my orthodontist ruined my life, or I wish I would have known. And
yeah,
there's a lot of, it seems like a lot of misinformation or a lot of people just
of
saying, oh,
course.
it's black and white. And so it would be great to get our fellowship trained sleep surgeon on to really talk
Hmm.
about these topics because at the end of the day, he's the one that has the authority to really delve into all of these topics. So I think that would be a really good future episode direction.
Yeah, I think we always have good conversations with Alan. Always learn something from him. So, yeah, that maybe is something we can look forward to in the future for next year. We also had, so kind of around the same time, we featured Eliane, and I personally really enjoyed speaking with her. I think she's really interesting. I think she's really just an inspiration to a number of people, just women in the field. I think international students, people who don't have the traditional route to becoming an oral and maxillofacial surgeon. So I think we both have had that more traditional route where it's okay, you go to college and then you're pre-dental and you go to dental school and then you match into residency and then you're an oral surgeon. And I think not everybody's path obviously is like that. And so for her to kind of be featured and tell her story was really interesting for me.
Yeah,
And obviously
so
she, like I said,
inspirational.
yes, very inspirational and just a really an example for how if you are truly passionate about something, you will not let other things stop you from achieving your dreams. And obviously she shared her story. She's been through quite a bit and is just really an example of resilience that not everybody has that. And so I think she really is an example and inspiration for people who are going through it, dental students, residents, because it's really not easy. I mean, it's a lot of years and it's a lot
No.
of challenging years. And so I think, yeah, I really enjoyed talking to Eliana and hearing her story.
Yeah, yeah, and I had the great opportunity to have Krista Zamora on our podcast. She's an assistant office manager at our oral surgery practices, and she is just a stunning example of how a, a oral surgery practice, a dental practice, and a medical practice, it's really it is the doctor that makes it, but really it's not. It's not the doctor
Hmm.
that makes a practice successful, and it's not just the doctor that gives the patient a great experience. It's the team that you have, and someone like Krista, she really shows how having someone like Krista on your team gives the patient a great experience and really makes the office. And so when surgeons are trying to put together an office, and often as surgeons do, we could be pretty self-centered. Uh, that's at least the stereotype. And so often when they're looking at a practice, it's all like me, me, me. What can I do? Me, me, me. What can I do? But
Hmm.
they got to look for people like Krista to bring onto their
Yeah.
team. Yeah.
Yeah. And I think vice
Eh,
versa, like if you have a, a not a good team or someone who's a team that's not as supportive or as good of a team for the doctor, then you can have the best doctor in the world, but
that's
what comes
absolutely
across to the
true.
patient is going to be really negative. Yeah, in terms of the
That's
care that they
so
receive.
true.
Hmm.
If you were to go look at medical office reviews, dental office reviews, you'll often find that the positive reviews, they'll have the doctor names, but often they'll include a lot of other staff members like, "Oh, but this person just she did so much to help me out, and this person made the process so easy." And then when you see the negative reviews too, a lot of the times they're not about the doctor. They'll just be like, this
Hmm.
person in the front was rude to me, or that person was didn't have bedside manner who wasn't the doctor. It's really interesting. So it is really your team that is the reputation of the office. And
Yeah.
like when you think about your doctor visits, unfortunately, the way that it is in America, often, like, what are they? You see the doctor for like 5 minutes, right? But you saw maybe like 20 other minutes of FaceTime with all of their
Hmm.
different staff. So it is the staff that really helps make that whole experience. So
Yeah.
yeah,
Well, they always
we were very
say
lucky
it's
to have
the
Krista on.
Yeah, they always say it's the front office staff or the person that greets you
Mm-hmm.
when you first
Mm-hmm.
walk through the door, the person that first answers the phone call when you call the office. They're incredibly important because they're kind of the face of the office that lets people through the door before they get to
Yeah,
you.
it's like they're the waiters and waitresses of a restaurant, right? Like when you go to a restaurant, you want to eat great food and it's
Mhm.
you're eating what the chef prepared. Like you came to that restaurant really because of what the chef can bring you, but your whole experience there was really how the waiter or the waitress took care of you and treated you,
True.
and that's what you really remember out of the meal. And then the food too, but you remember that face. It's that face
Yeah,
that you
you
remember.
always remember if it was, and you especially always remember if it was really bad service.
Yeah, and you could have the best food ever, but if
When
the
you eat a meal.
service was
Yeah.
like, your
Yeah.
waiter was super mean to you and like insulted your
Yeah.
grandma, like you're never going back there. Yeah.
Yeah. Exactly.
Yeah,
You're
really,
definitely not going
really
back if they insult your grandma.
important to have good team members. And then we were so fortunate to have Karen He come to town and come on our podcast.
I wish I was
Karen
there in
He,
person.
yeah, yeah. So she
Oh,
happened to
so
be in
sad.
town for a KLS course. I know we had a good time. Actually,
I
so
missed
I
out.
picked her up. I picked her up, and we were late to the studio because the Las Vegas Acers. That's right, right? You guys know how to. That's
Oh
correct,
yeah.
right? The Aces, Aces, the
Fact check.
Aces.
Fact
It's the
check.
Aces, right? Okay, Anthony's the
That's
basketball
why
guy.
Anthony is there. He's a fact checker.
That's why Anthony's here, because yeah. Okay, so the Las Vegas Aces. Wait, is it the championship? The Stanley Cup?
The Stanley Cup. Ooh.
Okay,
Yes, Anthony,
okay,
come
so
on.
we were late
Tell
to
us.
the studio because the Las Vegas Aces had won the championship. And so I was picking her up from New York, New York. And right when I got there, they shut down the street because the Aces bus was coming through on the parade. And I can see the
Ooh.
the basketball players like woo cheering. And I had to wait there on the street for like 45 minutes until they passed by. So we were a little late, but we
5
had a lot of
minutes.
fun. I
Oh
know
my
you wish
gosh.
I wish you were here. So yeah, and so of course like Karen, I picked up Karen and we had so much fun
Mhm.
together just driving around, chatting, and then we went to dinner after. I love that girl. She is
I
such a
know.
testament to how first off you can have multiple successful careers. We didn't really get into her backstory, but she's
Mm-hmm.
had very successful careers before deciding to become a dentist and then deciding to become an oral surgeon. But then
Yeah.
she is proof that you can have a family and still be an excellent resident, but that it's not without the help of family and loved ones around you to help you achieve those goals.
Yeah. Yeah. I wish I was there, but I have talked
We
to
had a lot
her.
of fun.
I am jealous.
I would rub it in your face.
But she is local. She's in Los Angeles.
I met her because of you.
Yeah, yeah. No, because I met her while she was rotating at Kaiser in Sunset. Yeah, I don't know. We kind of just clicked, and I'm glad we kind of stayed in touch. But I wish I could see her more. Even though I'm in Southern California, people don't realize that Los Angeles and Orange County are pretty far. They're not
Yeah,
too
they
close,
are.
especially West LA. So I haven't seen her in a while, and we gotta connect. We gotta catch up.
Yeah. Yeah.
But yeah, I've said it before. I don't know if I could have a family in residency, but major props to her and women who do that. It's definitely possible. Like Christy said, and like Karen said, if you have the right supportive system and you're thoughtful about it, then you can definitely make it work amazingly. But yeah, so those were all of our guests that we've had on this year. I can't believe it's been a year and we've talked to all of these people, but our hope, I think just in our conversations that we've had with all of these people, both on the podcast, but also offline with other people that we've met through oral surgery and through this platform and Oral Surgery Sisters. I think over the year in reflecting on it, we are very thankful. I think we're both very thankful to be a part of this oral surgery community. We're very blessed to both have kind of a variety of mentors who we look up to and we continue to seek guidance from throughout the year, even after we've finished our training. And as we've gotten older, we've also kind of met other people who are walking in our path, who are residents, dental students that we can continue to be a mentor to, like other people have been to us. And so I think just as I look at the end of the year, I'm very thankful to be an oral maxillofacial surgeon, to be a part of this community. And we both, I feel like, get to do something every day that we are passionate about and that we love. And through that, we're able to help people and really make a difference for our patients. And so I think we can both say that we're very thankful for all of these things throughout the year.
What were your most favorite oral surgery events in the last year?
Ooh, okay. One of them definitely, and every year, is the ACOM's Faces meeting. It's their, or the ACOM's winter meeting. It's usually in February, and it's their winter ski meeting. And it's a really, really fun event. This is like a little plug for everyone to go, including you, who you haven't gone yet. You need to go.
I know,
But
I know. I think because like you'll only catch me on the greens and the bunny slopes.
no, the
And
greens
that's
are
what
great,
my disability insurance provider wants to hear. Don't worry, I'm
Yeah,
not
I
going
know.
on
We shouldn't be
anything
talking
more
about
than
that.
that.
But basically it's like a winter ski meeting, oral surgery conference where it's a week long, Monday through Friday typically. There's really just a stacked lineup every year of oral surgeons and clinicians lecturing. So there's very solid lectures throughout the week, and it's a pretty much a variety, like orthognathic surgery, TMJ surgery, anesthesia, implants. So there's kind of a wide variety throughout the week. And
Yeah, but
then
what are you really there for?
we are there for the skiing. No,
Yeah,
we're there for the good times and the après ski. I
yeah.
learned to après ski, which is my new favorite thing. But so the lectures are structured kind of uh, in the morning and in the evening, and in between that, there's
Nobody's
time
making it to those
allotted for
evening
you.
ones. Just
I know
kidding, they
there's
are.
time.
I've
It's like
never
the
been,
après
so
ski
I'm just
evening
joking.
lecture. You should definitely go. But in the middle of that, people will hit the slopes. And so Christy and I, we grew up skiing. We went pretty much every year to Tahoe, I
Hmm.
feel,
Yeah.
for during our childhood. And we would ski at Heavenly in Tahoe. And so we grew up skiing when we were kids, but probably when was the last time we went as kids, would you say? Like maybe when I was
I think we stopped
15,
once we were
high
getting really
school,
into our high school
into our
because
high
we were
school.
just too
Yeah.
busy.
Yeah, we were busy.
Which is
So
crazy
we
to say. Looking back, I'm like, why are high
were
schoolers
we
so busy? Like, we
uh
were children.
sports.
We should have been enjoying
There's
our
a lot of
lives.
studying.
Yeah, high school is
Um
stressful. That's where it starts.
that's where it starts.
That's where it all started.
But
No more skiing.
yeah, we stopped. So we took a hiatus. So I think the last time I skied before, so I've been going to these ACOM's Faces meetings for the last 3 years, and I'm going again in this February, so it'll be my fourth year. But the first year, um, 3 years ago, I think it had been 15 years or so since I last went skiing. I know it was a really long time. And
I
so
didn't
I was a
realize.
little worried that, because I hadn't gone since we were kids, so I was a little worried about how rusty I would be, which I was a little rusty, but actually it is like just riding a bike because we went so much
Yeah.
as kids, I
Or
think.
like ice
And
skating because
so,
we would ice skate enough when
exactly.
we were little. And when you
Yeah,
get on the
yeah.
ice at first, you're like, ooh, I'm gonna break a hip. But
It's a little
then, 5
wobbly.
minutes in, you're like, okay, I got
Yeah.
this. Just don't run into me and I'll be fine.
Yeah, but I mean, we would pretty much just ski in Tahoe. So skiing at these, it's always at a different basically ski resort. This year it's in Telluride. And so it's a good time getting back on the slopes, doing that with your oral surgery friends, spending time throughout the day hearing from these world-class oral surgeons lecturing. and sharing their experiences, and then just connecting with all of these people that are you're meeting at the conference. So definitely a plug for the ACOM's Faces meeting, but that's probably one of my favorite events, oral surgery events throughout the year. What about you?
Well, this year I had the privilege of attending the Strawman exclusive conference. It is an
Hmm.
event that Strawman puts on for their top implant placing doctors. And I have the privilege of going with the doctor that I work with, Dr. Steve Huang, uh, great implantologist. He really got my immediate implant placement protocol to like pristine tip top.
I
So
need to
yeah,
meet
I
him.
got to go to that. It, it was, I mean, let's just say, okay, it's exclusive unless you have
How
the
many people
pleasure
were
of
there?
going. I'm just kidding. I'm just kidding. It was, I want to say they had like their, I think it's like their top 100 or top 150. When I think there
Okay.
were about, like looking around in the room, I think there was about 200 people in the room. I don't know how much of those people were Strawman reps and people from
Yeah.
Strawman and guests and whatnot, but it's just it's a great event to come together with oral surgeons who are interested in improving their implant technique to, like I said, the like the highest standard and highest success
Is it hands-on?
that they
Like, are
can
you
get.
placing implants?
It's not hands-on. It's more so because we are such strawman placers, they know that we're very familiar with the system and the products that they have. So it's more so to see what the latest research is in the company, the direction of the company, new improvements to some of the tools that they have, things like that. So,
Okay.
and then they put on a like a really awesome party. Yeah,
Uh,
it was great. It was in San
nice.
Diego
San
at that
Diego's
one spooky
gorgeous.
hotel. What's that? The Hotel
The Coron,
Coronado.
yeah.
At the Hotel
Or wait,
Coronado.
it was spooky? Is haunted?
Well, it's supposedly haunted. A close second event that I really enjoy and I hope I get invited back as much as possible is the USC graduation. The USC graduation for oral surgery is such a good time. It
It was a good
they
time.
when you graduate, you low key get roasted just a little bit.
It's not low key.
It's all HR approved, but it's just such a good time and you get to see all the old faces and our attendings now like look at us as colleagues and not young residents anymore,
Do
so
they?
it's like that added
Yeah.
element of it.
But it's like a reunion, and I think for you, it was especially felt that way because you had finished last year, or like this was your first graduation back
Mhm.
since graduating, right? Yourself, since you being a
Correct.
graduate.
Correct.
Yeah, yeah. But that was a good time. I agree. And it's always at the Jonathan Club, and everyone's all dressed up nicely, and
Yeah,
there's good
it's
food,
also
good vibes.
exclusive.
You also had a lot of CE events this year for your practice.
Yeah, we did. We had a lot of good
Hmm.
CE events to help give back to the dentists in our community that are serve as our referring basis. Because honestly, without them, our practice wouldn't be successful. They're the ones that really get the practice going. So it's again, it's going back to where it's not the doctor, it's everyone around you. It's the whole community that makes it successful. So I do have a couple CE events planned for the future next year.
Ooh,
Yeah, so we're gonna have a
find the
doctor. His name is
information
Dr.
here.
Oh, yeah, information here. We're here. So I do, uh, Dr. Jan Jaffers is going to come lecture for us. So he's actually been a former lecturer for Dr. Steve Huang's practice, Henderson Oral Surgery. So Dr. Jan Jaffers is going to lecture on the art of persuasion, but ethical persuasion to help patients increase their acceptance rate of the proposed treatment plan. And when I say like ethical persuasion, when you hear the word persuasion, you think like, okay, that sounds like a bad word, but a treatment plan, when planned appropriately and according to, all of our dental guidelines that we learned, it is everything that we do is for the oral health of the patient. We are trying to eliminate disease, eliminate infection, reestablish form and function. Unfortunately, the way that dentistry is, often patients interpret dentistry more as just like sometimes like a money grab and a
Yeah,
business
like sales.
and like sales. And so they don't realize like all of this, it's for their benefit and so that they could achieve the best health possible. Because if you don't have oral health, then you don't, what good is all this other health if like your mouth is just has fetid odor and carries an infection?
Fetid odor.
So
Oh no.
yeah, we don't want fetid odor. So uh, but so when we are proposing a treatment plan, there is an appropriate way and a tactful way to help patients see that this treatment plan is to benefit them and to help them. And so that's what this CE course is all about. And this is just our way to, give back to our general dentists. They benefit me so much. I want to help like give them some benefit too. And this, like I said, we're specifically bringing Dr. Jan Jaffers back because he has done CE courses in the past with our group, and he was highly um what's the word where he was highly
Recommended?
requested to return
Oh.
by our
Oh wow.
other referring doctors in Henderson. And so now we can bring Dr. Jan Jaffers to the southwest area for the dentists in the southwest area of Las Vegas.
Mm-hmm. Yeah, I think that's really interesting. I agree with you when you said that word. I was like, ooh, how is a patient
Mm-hmm.
wouldn't like to hear that you use the word persuasion to get them to agree to a treatment plan. But I agree with you on I don't know why, and I've thought about this in different ways before in conversations with other dentists and friends and colleagues, in that as a dentist, I every like how many times do you have people come up to you and say and realize that you're in the dental field or whatnot, and they say, "Oh, I hate going to the dentist." Like I get
So
that
many.
every single week. Yeah, I
Yeah,
get
and
that
they're
every
like
single
sitting
week.
in the chair like I'm working on them. I'm like, okay,
They're like,
you
"I
didn't have
hate
to tell
you."
me that to my face right now. But no, it's
Yeah,
okay. I'm
every
not
week. And I
offended at
think
all because I totally get it. I get it.
well, I think part of that is like it is scary to receive treatment inside of the mouth. It's a very sensitive personal area. But then also in terms of the sales side of things, I think it's just weird because people go to the doctor and they're okay with everything that the doctor's gonna recommend for them for the most part. Or if they don't decide to
Hmm.
go through with it, they know that they probably should. Whereas with the dentist, it's very kind of almost combative, like, wait, I need a root canal, I need a crown, I need this, that, and it's going to cost me how much? I think part of it is just the difference between medical and dental insurance and coverage for those
Hmm.
things, because dental work can get very costly, whereas medical insurance will cover certain things.
It's
And
almost
so
like
there's
sometimes
that.
patients are
Mhm.
suspicious sometimes
Very.
of the dentist. Even okay, our own uncle. So our own uncle, he, I believe this is a story. So he had a tooth that needed a crown, and the dentist had recommended that he get a root canal first because it was highly likely that he was going to need one, given how that dentist felt it looked. And I think he went to another dentist, and that dentist said, did not recommend, did not mention anything about a root canal, didn't say it, didn't, nothing. It just said, okay, I'm going to give you a crown. And so my uncle was just like, why is it that this other guy was going to send me to this guy and I'm going to do a root canal? And then this other dentist, he didn't even mention it. Like, I think that that first one's was trying to, get more procedures out of me. But what he didn't understand, and I totally see both sides depending on how severe the cavity was because I don't have the x-rays, and I don't think he pushed him to go get a root canal, but maybe he didn't explain further why,
Mhm.
which
Yeah.
for some patients when you start getting deep into the weeds like that, it's
Hmm.
sometimes not beneficial to them. So who knows the situation? But I could totally see both ways. The first way, if you're doing a crown prep on a tooth, sometimes that causes the tooth to need a root canal. Not always, but what would be really unfortunate is if you put the crown on and then you're like, oops, now you need to go get a root canal. So now we're gonna have to either drill through this crown that I just made for you, and or remove the crown, do the root canal, do a whole new crown. Sorry, you got to pay for a whole new crown. When you could have just been like, it's so close. I think you should just preemptively get it because I'm pretty positive you're gonna need one. Just go get it and then do the crown. But again,
Yeah.
all of this, I'm not a general dentist, I'm an oral surgeon, but these
Yeah.
are just things that I've learned and picked
Mhm.
up. And but the point is at the end of the day, what my uncles and our uncles said was basically, I'm suspicious of these people.
Yeah. But I get that even like monthly. Maybe not, okay, maybe not monthly, but a good amount throughout the year where a family, a friend, a colleague comes to me with kind of a curbside consultation in regards to their teeth, saying that their dentist is recommending this, this, this. What do you think? Why does it cost this much? They're suspicious.
Yeah, why does it cost that much?
They're not trustful. Yeah, they're not trustful of this dentist. But I think you're right. Like part of it is because if you don't have the time to explain all of that, one, but then two, a lot of the explanation that's required is very technical, and your patient is not a dentist or has no dental background typically. And so it's very difficult to explain it in a way that a patient will fully understand. And so I think it's a little bit more of a disconnect compared to the field of medicine for the most part, where in medicine you're having a problem, you're in pain, you're this, you're that, and then you go into the doctor and they tell you what's wrong and that you need this treatment. Okay, sure. Whereas for dentistry, sometimes you go in, you don't have any problems, and they say, you have a cavity, you need this treatment. And you're like, well, I feel fine. Everything feels fine. I brush my teeth, I floss, but maybe not effectively. And it's hard for a patient to understand that because they feel fine. Whereas generally in medicine, you're going in and you don't feel fine. So you're willing to accept it. I don't know, maybe that's part of it.
Yeah,
I don't know. I could
absolutely.
go on and on about this.
Yeah,
but but I don't even, how did we start talking about that? I don't know.
I'm having a CE event.
Oh yeah, she's having a CEE event. We're gonna persuade you.
What
Um,
what would what was your what would you say your actually I can answer your question for you. I was going to ask you what was your biggest accomplishment of the year, but you this year I would say you became out of your many accomplishments, you became a fellow of the American College of Surgeons.
yes,
Yay.
that did
What does
happen.
what
Yay.
does that mean? Tell the people what that
It's a
means.
little it's hard to explain. It is hard to explain. So this year I was inducted as a fellow into the American College of Surgeons. So I guess how can I best explain it? Let me think. As let's say as an oral and maxillofacial surgeon. Well, actually, let's rewind. So to highlight one of your accomplishments this year. So the first accomplishment of the year, Christy studied vigorously, and then took and passed her oral board exam. And that was at the
Yes.
beginning of the year, which was
Yes.
honestly, that's a huge accomplishment.
I
I
can't
felt
believe
very
that was
accomplished.
this year. It felt like it was
It
years
felt a long
ago.
time ago. Yeah, it felt
Because
like a
I've
long
just
time
been
ago.
partying ever since. I've just been
Celebrating
so
your
happy
board.
that's over. This
Yeah.
we'll do an episode in the future about how to
Oh yeah,
study
we
and
should.
pass the oral boards because now we both have and I think we have a good grasp on it. But the oral board exam is bananas, but it's similar to other board exams for surgeons. You have to go to a specific date of the year at a specific location, and they basically, for this exam, cut you off from society in various ways and provide the transportation for you in a Squid Games like manner. Just kidding, but in my memory, that's what it was like. where you get on a bus and you got to get on this bus. If you don't make this bus, you cannot take this test and you better be on the bus next year because that's it. And then you are in a single room and in three parts, two different examiners come, ask you questions about different cases that can be taken in any direction. And in a way, these directions are very nebulous because they can ask you about anything, but you're on a time crunch. You are like each case is like 10, 15 minutes, something like that. And once it's done, it's done. And you can't, and if you can't go back, like that's it.
No.
That's
Well,
it.
and it's oral, just to
It's
clarify, the oral
oral.
board
Yeah, it's
exam,
oral. You have to be
because there is
able
a
to.
written.
There was a written portion of it. Yeah, that was nothing compared to the oral words. But yeah, so you study for a long time, but you don't study in the traditional sense. You're just talking out loud, practicing in groups, and again, it's more just it's so nebulous that you just have to be prepared for any and all things.
Hmm.
Yeah, and
Yeah, it's just
I felt really good at one point, but I told you like there was one part where I swear I was like, I failed. And I was in the bathroom and I was just looking down at my shoes and my head was spinning. I was like, oh my gosh, did I just fail? Am I gonna have to get back on this bus again and stay at this Crabtree hotel in North Carolina again and get on my Frontier flight or whatever
you
cheap
took a Frontier flight?
airplane I took? But I passed, so that was good. Yeah, but then I remember
Yes,
I really was like, get your head in the game. Come on, you can do that. I
in the
was like,
bathroom.
slap myself. I was like, okay, go back in there. You have one
That's
more
what it
section. You
takes.
could do it. And I did well. I did well. They gave us like a percentile after I did very well. So, yeah,
Not
I'm just
surprised at all.
thank God
You were very
thank
prepared.
God that's over. Yeah.
Um, yeah, but anyway, so
But
so
what
just
that
to get
means
back,
is I'm board
yeah,
certified in oral and
she's mhm,
maxillofacial surgery.
yes.
You do not have to be board certified to practice in your field in dentistry, but it does show that you've obtained a level of knowledge and skill and gone through the hoops to say that you're board certified. So, yeah.
Hmm.
And we both are board
Yes.
certified.
Yes. How exciting. But yeah, so to get back to the FACS, um, so if you take so oral and maxillofacial surgery, like we talked about, the oral board exam, that's kind of like the final boss that you have to pass.
He
And
really
then you're
is.
board certified oral and maxillofacial surgeon. And so, kind of a next step beyond that, the American College of Surgeons is a
It's like a side
community or
quest.
organization, yes, of all surgical specialties, not just oral and maxillofacial surgery. So, surgeons from other specialties can apply and be inducted as a fellow in the American College of Surgeons. And so, by applying to this, and once you if you are inducted as a fellow, it's you can use the credentials FACS, Fellow in American College of the American College of Surgeons, as kind of like another credential that signifies kind of a next level distinction of kind of the next standard of excellence, I would say, or um,
Totally.
beyond just your
That's a
board
great way to describe
certification.
it.
Yeah,
Hmm.
just beyond your board certification that holds you to a level that goes across all surgical subspecialties. So that's kind of the best I can explain it. It's kind of a little bit confusing and difficult to explain, but it's another credential that you can have, and it was fun because the ceremony was in Chicago. We kind of took a whole family trip out there and made it a little
Yes.
vacation. We went
Yes.
with two of my close friends and colleagues, Alan Huang, who we've talked about so much, but then also Kyle Schiffler, my co-resident
Yeah. Yeah.
from
All three of
USC.
you were inducted
Yes,
into the
it was a
American
little
College of Surgeons
reunion.
Fellows this year.
Yes, yeah.
Yeah.
So that was
Well,
that was a good
I
time.
feel like I really rallied the family to come because it was you had to wear the little motorboat, the little mortarboard thing, because it's like you were
Yeah,
graduating. And so like a
it
little
is like a little
little
graduation.
backstory. We didn't really of course we celebrated birthdays. We were not like abused kids, but like birthdays were not really a big deal. We did not have parties. We did not get like big parties as little kids. But when we had graduations, and really this started like after college, it was really like dental school. Like my
But we did
father,
graduation dinners,
we
like
did,
high
yeah, we did.
school.
We went to dinner, but
Yeah.
we didn't go all out. So
It became
my
more and more.
Yes, yeah. So the graduations are when we get parties. Graduation, my parents go all out. They are so happy. They are living their Asian parents' dream come true. So they for whatever reason, we go to a Brazilian steakhouse. That's just a standard. If
Yeah,
you guys went
that's
to
since
Brazilian
dental
steak the
school.
other day, and I was really confused because I'm like, did someone have a graduation that I was not aware of? Because that's there's no other reason for Brazilian steak, but we do Brazilian
There's
steak.
not.
And for my dental school graduation, at least for me, we did Brazilian steak. My dad took everyone to the Mandarin Oriental. It was back when it was the Mandarin Oriental for high tea, which again, this is the guy like
So
we did not
fun.
have parties growing up. And then on another night, he took everyone out to Top Golf, and it was just a whole weekend affair.
Fiesta.
And everywhere we go, it's always an open bar. Like that's part of the graduation deal is my
Hmm.
dad has open bar policy during all these events. He
Like a
just goes
wedding.
crazy. Yeah, and but now since we've graduated, like there's no more Brazilian steakhouse
What
in
else
our
do we
future.
do?
So yeah, so that's why I was like, Kimiko's gets to wear a mortarboard, guys. We all need to get together for her in Chicago.
And we did, we
And we did.
did.
We had steak. It wasn't Brazilian, but we ate at the
We did
Gibson.
have steak.
Yeah, we
But
did have
that's true.
steak.
Like a graduation is the one, well, that and like a wedding, I would say, but those are the only times the entire family rallies. They clear out the schedule, whatever
Yeah, they
else
go
they
mad
have
wild.
planned, it gets axed, and then we all meet up at this graduation, and it's a big deal. But yeah, but yeah, those were I think those were some good highlights of the year, some good milestones and achievements of the year. I think another one we forgot to mention is after Christy passed her boards, she helped kind of build her office and open up her office from the ground up. And that's
Yes,
honestly,
yeah.
that's a huge accomplishment.
Yeah, so
That's
I was
crazy.
like I said, I was practicing in Dr. Steve Huang's office. And we're still partners, but together we opened Blue Diamond Oral Surgery, and we haven't been open even for a year yet. We really opened April or so, but it's been yeah, the growth has been tremendous. And like I said, it wouldn't be possible without our team. I was just telling my team today, like I just if you I was reading, we got some reviews today, and it's really like sure they reference me a little bit, but they're just like Reese really made my time special, or I had an amazing assistant Roddy. So yeah, we've had a that was great. We had a great year for the office, and can't wait to see it keep growing. Yeah.
I think it will. I mean, if you think about where you started, like that first month, I remember getting a lot of phone calls from you telling me about the struggles of starting an office or opening up the doors to where you are now. That is crazy because it's not, like you said, it hasn't even been a year, but it's really not been that long. It's barely been half a year, you know? That's so exciting, Papi.
Thanks for poo. Oh
Also pause,
yeah.
like, should
Everyone's
I be
always like,
looking?
why is your Instagram handle call me by Papi? I get
I
that
know.
question so much. Let me just clarify. That's my personal
Oh, okay. We're gonna
Instagram.
clarify.
Try to add me. We'll see if I no, I'm just kidding. Okay, so yeah, everyone always asks me why are you Papi? Because I'm Papi and you're Papu.
But how did that start?
I don't know. Tis a
Nobody will
mystery,
know.
but that's what it
We'll never
is.
know.
Papi is
We'll
my
never
name
know.
and Papu is you.
It
Okay.
is. You know
Well,
what?
should we end this? Oh,
Oh
okay.
wait,
Oh yeah.
I totally forgot to mention the ACOM's Faces meeting last year. One of the highlights of the year was that when I got to meet Dr. Reinicke, Dr. Johann Reinicke.
Did
I
you take a
know.
picture? Did
He
you get an
is,
autograph?
I did. He signed my scrub cap. But yes,
Wow.
and we got to speak to him, and obviously he gave some of the lectures at the Eight Comes Faces meeting. But Dr. Rainica, for those in the outside of the oral surgery community, but for those that are in the oral surgery community, know his name from the many publications and textbooks that he's written. But he's basically kind of obviously a well-known surgeon in our field who really has advanced the field of orthognathic surgery, which is a surgery that I specialize in, and really just an honor and pleasure to meet him. He's super nice, very friendly, just had a lot of interesting stories. He has a really interesting background. But yeah, I took a picture with him. He signed my scrub cap. I told him that I'm from USC, and at USC every week we would have those lectures with Dr. Yan, and we would review parts of our chapters from his book, which I think he really enjoyed hearing. But yeah,
Of course he did.
but yeah,
But
that was a
but
highlight.
how was he on the slopes?
He told me that he wasn't hitting up the slopes that year, but
Boo.
you know. I think that was a pretty good reflection on the year. We had a lot of good moments together and separately. But we can end this by talking about, what do they call it? The Spotify Wrapped list,
Yeah, our oral
or
surgery sisters wrapped.
our Oral Surgery Sisters Wrapped list. Okay. Okay, let's go. So, Christy, what was your favorite surgery this year?
So many, but there's, for whatever reason, I got referred a lot of oral antral communication closures this year. I
Mm.
don't know why, but
From
or maybe that's
extractions
normal.
from
Maybe
dentists, or?
that's, yeah, like after an extraction,
Okay.
basically from outside. But
Okay.
I've just been getting very good at those. I'm sure it's a basic procedure. It's not anything that is technically super difficult, but there's different ways that you can do it. There's timing with the antibiotics, and when you have acute sinusitis, it could be
Hmm.
pretty nasty. But
Yeah.
I've been doing a lot of those to the point where when I get one, I'm like, I like doing these. I
Yeah.
would like more of these. Yeah, and
Well, I
I
think
have like
also,
three different ways that I do it too. I don't just do it one
ooh,
way.
we can do a whole podcast on that.
Honestly, we really can. In the
Oh,
way where you think just Tori, right? Like Tori or Tori. They're not. Like Grant Stuckey on his podcast, Everyday Oral Surgery, they had a whole podcast episode just how to remove mandibular tori. And it's so
well,
interesting. So yeah, you could literally have a whole
yeah.
episode just on
Well, I
that
think
that
though,
procedure.
closing an oral antral fistula, it's very satisfying to do. And then two, I think the patient really goes does a 180, because usually they come in and they're really uncomfortable. There's liquids going up their nose. They have pus coming out. They're infected, and so they're super uncomfortable. And then when you do that for them, then they are so happy. But then also, I think just the surgery itself is a satisfying surgery.
What about you? What was your favorite surgery of the year?
I don't know if I can pick one, but definitely an orthognathic surgery. That's just my favorite
Surprise.
surgery. So an orthognathic
Yeah.
surgery, maybe a more like an orthognathic surgery where the patient has a really severe malocclusion, or like a significant jaw asymmetry,
What
significant
do you like
asymmetry.
doing better, class 2 or class 3?
I don't know. It just depends. Depends on the day. But
Okay.
that an orthognathic surgery. But also, I was really fortunate to be a part of a surgery with Dr. Stringer this year, where he did a Lefort 3 for a patient, or a modified
Oh
Lefort 3
yeah.
for a patient. That was an exciting one. But
He let you do
I
the
got to
down
be a part.
fracture? You did the down fracture?
I helped with the down fracture,
Okay.
because
Okay.
you kind of need one person to do the down fracture, and then the other person to kind of help mobilize the segment at the ZF suture, or the zygoma area. But anyway, we can get into that later. But probably, definitely an orthognathic surgery, maybe that one. Ooh, okay, what else? We kind of talked about this. What was your favorite oral surgery event this year?
Yeah, the USC graduation for
The
sure.
USC graduation, the roast. But you know
Yeah,
what?
if
I
you
forgot
you
to
just
talk
had to have
about.
been there.
I
We can't say
I was
anything more.
there. Um, I forgot to talk about the CCOFS boards review course because we were talking about boards, but that's another fun one that I've gone to for the last 2 years. But their boards review course, which I think is I would strongly recommend for people studying for the oral board exam that we talked about. But it's basically just an oral board review course, but they kind of add on other lectures from very specialized oral surgeons and their expertise. And so that's a good one. And for me, it's just like a little reunion back in Charlotte with my friends in Charlotte. So that's a good one. But probably my favorite oral surgery event, probably either ACOM's winter meeting or Chicago. That was fun. What was your favorite sister moment this year? There's too many. There's too many. Okay,
Uh, that wasn't this year though. We said it's not wasn't this
yeah,
year.
we can talk about it, but it was actually last year. Um, you know what I really enjoyed was, which I don't know if this was a sister's moment. It kind of, in a way, was. It was like an Agari moment. But when we had our family reunion this year, yeah,
Yes,
we had our,
yes.
so
That
we
was
had
our
our
best
family
sister moment.
reunion. Yeah, it was different. So, we are not the type of family that we have regular family reunions, but on our father's side, we did have a family reunion that one of our family members decided to put on this year so that we could essentially kind of reconnect, but then also learn about our family history from that side of the family. And again, we've never really done this. And so we did this in September in Stockton, California. And so Christy and I are both from Stockton, California. And we were born and raised there, and we have really strong roots in that town, in that and we're both fourth generation Japanese Americans. And so when our ancestors on that side of the family came from Japan, they their roots in Stockton, California. And so we've had multiple generations in that city. And so it was a good opportunity for us to, again, reconnect with the family. But I feel like we both learned a lot about where we come from and the stories of how our family came from Japan to California. We heard a lot of stories of our grandparents, our great grandparents that we've never heard before. And so I felt like I was really happy that I went to that, and I feel like I learned a lot. And so I think that was a highlight for me
Yeah,
this year.
Anthony had mentioned that well, I told him one of the reasons for our like I guess I don't know if we call her a great grandmother or one of the original settlers that came into America. One of the reasons she left was to seek opportunities as a woman in America because in Japan, even though she had quite a comfortable life, there was only just a high level within her household as basically a homemaker that she could ever get to, which is fine, but she wanted more for herself personally. So that's why she came over to America. And then she ended up becoming like a business owner. And so Anthony was like, isn't it so is it I guess it's serendipity? I don't know if that's the word that your ancestor came here for that reason and now you are a woman in oral surgery and your sister is too in a field that's still quite dominant male dominated.
That's funny that you bring that up because I had emailed Uncle Jimmy after the reunion and just thanked him for putting on the event. And then he actually emailed me back and he said um, that if we reflect on it, it's likely that a lot of our passion, our drive, our discipline comes from our great grandmother or Obachan because we share some of the characteristics that she and even Grandma Masako had, and like you said, was the reason that they decided to come to America from Japan for these opportunities. And so it's kind of nice to think of, but like you said, both of us pursuing our dreams and becoming oral and maxillofacial surgeons because that was kind of the dream that Obachan wanted for us or sought out for us when she first set sail to come to California. So that's so sweet that
Yeah.
Anthony said that.
Yeah, he did. Yeah, he did say that.
Huh.
So, yeah, I guess we'll continue to keep the trends going in the new year in 2026. It was so nice to look back on this year with you. We had like so many good times, and we're gonna keep the good times rolling in 2026.
We definitely are. Yeah. Thanks everyone for listening and following along with us on our journey. Obviously, this is again very fresh for us. We just started doing this year, but it's been fun, and we're very thankful and we feel very blessed to be a part of this community.